Up. There we go. Once more. Wow, I didn't realize there was so much setup for this.
Well, it says we're streaming, but are we really streaming?
Okay, good. Okay, awesome.
Yeah.
Hello, everyone. Hello, Frisco. We are live here on Lifestyle Frisco with Dr. Sean Hill of Lone Star Plastic Surgery. Hello, Sean.
Hello, Wendy. Yes. Hello, Lifestyle Frisco community. Hello, Facebook. Hello, Frisco in the world. How are we all doing?
Yes. Exactly. So happy hump day, everyone. So we wanted to have Sean on because not only is he doing amazing things, volunteering his time as a surgeon and a doctor here in the community, but I wanted him also to kind of give us some tips of how we can all come out of quarantine in style, in beauty, and grace, so that we all don't lose ourselves here during these last several weeks and for however long this is going to be in effect. So, Sean, welcome. Thank you for being here.
Of course, it got me out of the house. I mean, yeah. I'm kind of climbing the walls at home right now, so this is giving me something to do. No, I'm kidding. I mean, I'm not kidding. I am climbing the walls, but it does give me something else to do besides, sit on Facebook and talk about myself or something else. So how's it going? I'm good. Thanks.
Well, speaking of talking about yourself, we're going to talk about yourself. So let's talk about a little bit about your background and your history and how you started Lone Star Plastic Surgery.
I'm from small town USA, a cornfield in the middle of nowhere, Illinois, and first doctor in the family, first person in medicine in the family, actually. Wow. Went to med school there, did all of general surgery training back at the University of Illinois, and then came down and did plastic surgery at Parkland and UT Southwestern, and then realized that number one, Illinois is super cold, and I didn't want to go back to the cold, and then number two, DFW is a pretty awesome place. Yeah. And so I didn't want to leave, and so I decided to start my plastic surgery practice here in DFW, and looking at kind of the demographics of things, chose Frisco because I kind of am a small town boy at heart. And so Frisco has a little bit of the small town community feel, but it's also got the cosmopolitan side of it that can help support, a vibrant medical community. So thus Frisco, Texas.
Yes. So tell us what services or what you're doing now during these times. And then also, what can our audience be doing if they're thinking about having services once all of this is over?
Yeah, I mean, obviously things are a bit limited. There's the social distancing that we're all practicing. In fact, our office is actually the doors are closed, except for those folks who have, I take a call at the emergency department. So folks I see there that need stitches taken out will come into the office. But other than that, it's pretty much the doors are closed. We are, as I say, our doors may be closed, but we're always here for you. And how are we here for you? Well, I am doing virtual consultations for those folks that are thinking about having plastic surgery and kind of want to get the ball rolling. So we do that via, it's via a medical software, which is quite similar to Zoom, actually. So it's similar to this, but it's privacy protected. And so we're doing that. I am also doing virtual skincare consultations because the one thing, people always ask me, like, your question is, well, what can we do right now? Because I'm sitting here staring at myself on these Zoom calls, and I feel like people are telling me, and quite frankly, I actually found myself staring at myself the entire time and didn't notice ... And so what can we do about it? Dr. Hill, can you just come to my house and do, drive-through Botox or something like that? And the answer is, unfortunately, no, I can't. As much as I would love to have a 6-foot needle to inject Botox with, I don't have one.
Right.
So thus, things like that are off. So what can you do in the interim? Obviously, stay healthy. Number one. Number two, stay hydrated and all those kinds of good things. But really, the one thing you can be doing at home for your beauty routine is having a good skincare regimen, and I think that's something that is often neglected. I mean, I have people come into my office who have been getting Botox, fillers, even had surgery in the past, and just you ask them what do you wash your face with, and I get the Dove soap, or something I got at Target. And I'm like, well, that may be all well and good, but it's kind of like the whole, if you want your car to run well, you can put regular unleaded in it. But if you want it to run like a sports car, you need to put premium in it. Same with your face. If you're just kind of washing your face with kind of something you get over the counter, then, if your skin doesn't look good, there's probably a reason for it. I think that you can see a difference in a patient who comes into the office who is, say, a certain age, who takes care of their skin, and then a person comes in next who hasn't taken care of the skin. And there is a dramatic difference in their skin quality and how youthful they appear. So the basic thing for anything that I do, in fact, I won't even do a facelift on someone unless they are doing good skincare. And so I make sure they're doing something before I even think about it. Do
you carry specific product lines? And if so, what are those?
The only product line we currently have in the office is Zeo Skin Health. It's by Zane Obagi. So I don't know, you're probably too young, Wendy, but people that are a little bit more senior will remember the name Dr. Obagi, because he was like the skin guru to the stars in the mid 2000s. And so he had his original line called Obagi with an O, and he sold that and then has developed this new line. And so this is his new and improved, latest and greatest stuff. And it's, in my opinion, it's kind of like the Cadillac on the market. This is the most powerful and best stuff you can get. It's what I use at home. If people out there follow me, they will see that I actually washed my skin on Facebook Live yesterday. So you can see me using my Obagi stuff. It's the only stuff that I would let a loved one use. It's what all the staff in our office use. It's what everyone, my coordinator Carrie has been using the Zeo line for God knows how long. If you take a picture of her counter at home, it looks like she owns stock in the company. Wow. So it's the best stuff. It's great. Your skin feels great afterwards. I mean, if you put somebody on this in about, in a month, you'll notice a complete difference in their skin. So that's all that we carry now.
So disclosure, because I want to talk just a touch more about Obagi. I know exactly who they are. When I turned 30, I had, and I don't know if they still offer this, an Obagi blue peel, that intense peel. Yep. Oh my God, that thing, I shed skin like a snake for 2 weeks almost. They still do that? Do you provide that?
So the blue peel was like, you're right, it was like the best thing on the market. I mean, that's what made him famous, was that blue peel, because you did that and you just emerged from that, and your skin, it was like the butterfly from the cocoon. It's suddenly you're transformed.
15 years off your face.
Yeah, he's got some new stuff now that if you message me about it, it's called the Radical Night Repair. It's one of the new things he's got out there, which is a high dose retinol, which your skin will kind of peel like that, and you'll emerge with that looking amazing. I mean, that's kind of the biggest thing I've been selling now, because but you bring up a good point. I'm sitting in a home right now. Now is the perfect time to have the peel, because you're sitting at home. As much as you're doing these Zoom meetings, you really don't got to go anywhere. And so if your skin is peeling off, now is the perfect time. So yeah.
Okay, we're gonna need the link to that product. We'll put it in this live.
Sure.
When we're done, I'll go back and edit it. If people can order it online.
Yes. I mean, and the other thing too, actually, right now is if you message me, we can order, and we actually get free shipping. Okay. So essentially, you order it through me, and we'll take care of all that. And it will show up at your doorstep in, how long it takes to order things, 3 days maybe. And you won't have to leave the comfort of your own little sheltering at home quarantine. You can stay in your bubble, you can keep your sweatpants on, and you'll have some skincare stuff. So there you go.
So do you want us to call you, or do you have a URL?
You can call the office, 214-93. You can put the link at the bottom down there.
Yeah, we'll put the link in.
Call, email. You can even message us on Facebook. That's fine too. I'll accept those. Message me on Instagram, whichever you prefer. Like I said, we're kind of doing skincare consults. So if you don't necessarily want something as intense as that, we can also do, a skincare regimen kind of tailored to, your particular needs, what you need. If you're a person with acne scars, if you're a person with rosacea, if your main concern is sunspots, I mean, whatever your concern is, we'll find a regimen for you, and then we'll get it shipped to your doorstep for free. So there you go.
I love it. I love it. Well, you're getting a phone call from me after this.
Oh, sweet. I got the phone right next to me right now. I'm ready to roll.
Fantastic. Okay. One last question, and it's personal. What are you doing right now to keep the crazy away? What's the fun things?
Well, what am I doing to keep it crazy? I mean, honestly, like, as much as I want to say I'm doing something fun, I mean, I'm doing fun things. Like I'm doing lots of long dog walks. But really, quite frankly, what I've been doing to keep the crazy away is I actually have been volunteering, which sounds insane, but once a week, I'm actually over across the street from my office at Baylor, and they're doing mobile testing right now. So I'm doing little swabs on there to kind of at least make myself feel like I'm doing something medically related, because quite frankly, as much as I enjoy talking skincare and doing these virtual consultations, it's nice to actually you don't interact with people because they drive through and they don't roll their windows down, and we just kind of do it like that. But admittedly, it's nice because at least then I am close enough to person that I feel like I'm kind of doing something to interact with people. So that's what I've been doing to keep the crazy away.
Well, and not only are you keeping the crazy away, you're actually helping our community, and I love it. Dr. Pill, thank you so much. We're going to put your phone number underneath, and everyone get your facelift going right now in the privacy of your own home.
There you go.
And thank you so much, Sean, for being with us today. We appreciate it.
Of course. Thanks, Winnie. Thanks a lot, everybody.
All right. You have a good day.
You too. Thank you.
Bye.